day. For a COVID-19 update, Missouri's 7-day average for new cases as of yesterday is approximately 1,700 per day. Using the CDC method, our 7-day positivity rate is 11.6%. Using the state method, it is at 23.5%. As I said last week, both of these rates are now reported on our public health dashboard. For hospitalization, the 7-day average is roughly 1,400. However, I want to assure you that overall our healthcare system is still meeting the demand. Of Missouri's 22,000 total hospital beds, 49%, nearly half, are still available. We also have nearly 70% of ventilators that are still available. We are extremely thankful for that the vast majority of Missourians are recovering, but we know there are still many that are suffering and families that have lost loved ones. Our hearts and prayers are with them. Last week, we met with Cox Health on the new saliva-based COVID-19 test. We also discussed some of the biggest challenges facing our hospitals right now. Areas like Springfield are seeing a lot of patients transferred in from smaller hospitals in surrounding communities, putting additional stress on systems like Cox. During our meeting, we talked about empowering rural hospitals and equipping them with the tools to care for more COVID-19 patients, which would help relieve some of the stress on our largest hospitals. We are looking into ways that we might do this, such as the ECHO program with the University of Missouri. Our healthcare workers, rural and urban, have been on the front lines for almost 8 straight months. They are tired and overwhelmed, but they continue to rise to the challenge and take care of Missourians. We cannot thank them enough for their efforts, and we will continue doing everything we can to support them. On the testing front, we continue to expand capacity across the state. We now have 2 confirmed locations for the saliva-based testing machines developed by Washington University: Truman Medical in Kansas City and Cox Medical Center in Springfield. In addition to these, WashU's own machine, the 2 others we have will go to Central Missouri and Southeast Missouri. This week, we began shipping Avid Rabbit testing to K-12 schools across the state. Nearly 330 schools and districts applied for the test through DESE, requesting a total of nearly 583,000 test kits. These tests are a less invasive nasal swab that can give results in 15 minutes. Many schools will be performing these tests on site. Some others have partnered with their local health department or medical provider to administer the test. Missouri expects to receive a total of over 1.8 million tests. With the election quickly approaching this week, we know there are a lot of concerns about voting safely. Yesterday, I had the chance to meet with the St. Louis County Board of Elections and Secretary of State Ashcroft to review new COVID-19 safety measures for Election Day. And I want to assure you that our county clerks, poll workers, and local election officials are taking every precaution possible to make sure Missourians can safely cast their vote. We received great feedback from voters on the primary election in August, and we are confident that the general election will be successful as well. We are also focused on protecting our election integrity. We are proud that Missouri has always had very fair and secure elections, and as with every election in our state, we are committed to safeguarding the process. We are coming up on 9 months of dealing with COVID-19 here in our state. And I want Missourians to know that we continue to work extremely hard for the people of this state. A tremendous amount of work has been accomplished since March. I encourage everyone to take a look at a new page on our website highlighting all that has been done. From education to public safety to child care and families, mental health, high-risk populations, the economy, and much more. Since day one, our entire cabinet team and state workers at every level have gone above and beyond the response to COVID-19. And as a thank you to our state workers, state offices will be closed on Friday after Thanksgiving. We hope that our state workers can take this time to rest and spend time with family and loved ones. I want to thank not only our state workforce, but our healthcare workers, teachers, law enforcement, child care providers, grocery store workers, truck drivers, and all Missourians on the front lines. All Missourians have played an important part in this, and we are so thankful for your efforts. And it does not stop here. We must continue to work hard. We must continue to social distance, wear a mask, and wash our hands. We must continue to push forward while protecting ourselves, our families, and our neighbors. Together, Missouri will overcome these challenges. Thank you, and God bless.
where I hope and pray we will have much better treatments and vaccines available. So again, it's the high-risk sports where we've asked that there be limitations just for the time being. And again, the fact that the IHSA has a different opinion, I mean, I've known that for some time about different areas of sports. We have talked to them on a frequent basis, gotten their opinions about each one of these things. And I think most importantly, I think it's going to be incumbent upon the schools to make decisions for themselves, and that's what we've left schools to do, to make decisions about how to keep the children, the kids who go to school there, the people who work there safe. And we're trying most of all to get kids back in school. We have 1.8 million children who are not in school every day in this state. We want to get kids back in school, and sports is a secondary question, but we want to make sure they're learning, first of all. And so we want to lower the risk that we, in every way that we can, and we're going to continue to work on that. I finally will say that schools, I think, as I've said several times, will potentially be subject to some legal liability if something happens as a result of their playing a sport that, that we've issued guidance about that is not congruous with what the school is operating under.
And this will be Mike Lowe at WGN.
Oh,
Mike
yeah.
Lowe at WGN has a question.
Sure.
University of Chicago scientist Sari Kobe has questioned if the positivity rate metric is the most useful and accurate one to guide public health decisions on restrictions. Could you explain why you rely on that metric?
Yeah, sure. If you wouldn't mind, I mean, I'll at least begin by saying, remember that just looking at the number of cases, for example, doesn't really tell you anything. There are states around the country that aren't testing. So guess what? They don't show any cases, or very few. And you can't make a judgment about how widespread the transmission is occurring, whether there's truly mass community spread, unless you're looking at positivity rates. So that's an important thing about why we rely upon test positivity across and that's what we use absolutely for decisions about mitigations. We also use hospitalizations. As you know, we pair up hospitalizations with positivity on an upward trend, and that too is a trigger for certain regions have triggered that. I think Cook County, suburban Cook County triggered that recently. But I'd like to turn it over, if I may, to Dr. Landon, who may have other things to respond to.
Yeah, I read that article too, and Sarah Kobe and I are friends. We've worked together on other work before, and I think she really is a world-class epidemiologist and computational biologist about respiratory viral illnesses. But in a pandemic, no one has the monopoly on expertise. You have to work with modelers. You have to have people like me who are experts in transmission and sort of infection control. You need to have public health officials. You have to have sociologists. You have to have economists. You have to have virologists. You have to have lab skills people. You have to have every specialist, and somebody has to make the decisions. There's no one person that gets to make all of the decisions, and like I said in the talk, there's no one metric. I think it would be a mistake to characterize her comments in that piece as being that she just thinks that that's the one metric everybody's using, because I think we see that there's a lot of data, a lot of metric.
That as part of your overall.
It's not my decision. I'm just one piece. I'm just one voice. The governor gets to make the decisions. He's our elected official, and he gets to find a way to balance all of those different experts that are speaking in his ears. And there are lots of, all of us have different things that we care a lot about, and I believe a lot in the things that I say and the things that I recommend. And Sarah and everybody else who has your ear and everybody's ear cares a lot about the things that they're recommending. But there's no one right way to do it. We have to make choices and trade-offs, and that's why you get elected.
But I will say, if I may, to your question, that the positivity rate plays a very important role. I mean, there are a bunch of metrics. We showed you a number of them here. What we want to do is try to look at the metrics at the front end, not just cases, but case positivity and test positivity. We want to make sure that we're measuring not just the number of people who are getting the virus, but how fast is it moving? And that's why we look at all of these measurements. To say that we're only looking at one measurement isn't exactly correct. The other thing is we make a lot of public policy decisions, as you know, around whether we are going to distribute PPE to certain places, how we manage certain locations. how we, whether we think that a temperature check is as good as some other method of keeping workers, let's say, out of a place where they might cause transmission. And, measuring whether